Now let's come to the foundation, the basic aspect of epidemiology. When you study infectious disease, we have to understand about epidemiology, because we have to describe that specific infectious disease epidemiology in terms of distribution, determinants, and in the population. So epidemiology is the study of the distribution. Okay, first is the word distribution. I want you to concentrate on the word distribution. When I say the word distribution, what I mean is person, time and place. You have to study about the distribution of that particular infectious disease. Let's say if we are looking at malaria, then we have to say malaria in terms of person, means who is that person, what is the occupation, where is the disease. Okay, so who, person, time, when it occur, during the rainy season, during certain time of the year, seasonal variation, person, time and place, which, where, okay, is important. Here in the country, in the continent, in continent, mean we know that now a lot in Africa and in certain part of Asia, in India, okay, and then what groups, what are the population at risk. Okay, so it describes what, who, when, where. Okay, the word distribution is what, who, when, where, or person, time and place. And then we know that distribution, it needs, it's not going to distribute. Why it is must distributing to certain person must be infected. Okay, like HIV, why certain group of population is infected? Because they do not use condoms, because they have low immunity, because they have high risk, okay, or they have a risk behavior that are prone to infection. So determinants is important. So determinants answer why, how. So distribution answer what, who, when, where. And determinants try to find the causation. What is the cause? Okay, behavioral or genetic or other causes. Okay, causal relationship or cause-effect relationship or risk factors. Okay, it will be under the determinants. And then we describe in any particular issues or problems, health-related events or non-health related events. Now we can use the epidemiologic approach, but in this context we are talking about health-related infectious disease in the populations. We are not describing talking about epidemiology in individual at the individual level. We are talking about the population level. For example, we are saying that the prevalence of the disease is 30% in this population. The incidence is 15% per year. Okay, or the incidence is 10 per 1,000 per year. It means that out of 1,000 population, 10% will be having coronary heart disease per year. Okay, so therefore, so in epidemiology, in principle, we would be describing what, who, when, where, why, how. Okay, in the population. So it is the study of the distribution and determinants of health-related events, okay, disease occurrence in the specific population. And once we know what, who, when, where, why, how, then we can plan. Okay, we will be planning for application, how to prevent and control that problem. So it's not only to know what, who, when, where, why, how, but we're going to know also how we're going to take care of it, how to control and prevent that particular problem to recur or to occur in the population. So that is what is epidemiology. So if you look at this particular diagram, you will see that distribution is the part is we are trying to first describe the problem or identify the problem. So it means describe the problem in terms of person, time and place, or what, who, when, where, and the determinants is identify the risk factor, and that is why and how. So I think with this slide I summarize very quickly for you to understand about the epidemiologic. And once you identify what, who, when, where, why, how, then we will see that this would also, we are going to plan for prevention and control. So in this, the first part we call descriptive epidemiology. If you study only the distribution of the problem or of the disease, then this part we call descriptive epidemiology. If you use this to just describe person, time and place, but however, if you are going to study about the determinants of the disease, then this part we call analytic epidemiology. And the third part is we call applied epidemiology, when we are going to do the intervention, how to prevent, protect, promote, okay, and control the disease. So epidemiology would be classified as descriptive epidemiology, analytic epidemiology, and applied epidemiology. Okay, I hope you understand this particular part. Okay, so in the as I already told you, we ask these questions to when we have a problem, and as you know, distribution, person, time and place. Okay, for example, dengue, if I'm going to have a distribution of the dengue, I'm trying to describe where is dengue, the global dengue, where it is occurring in the world, in South America, in Asia, in Thailand, and then time, year by year, where is a geographical area, how it changed, how is the trend, whether it is high or low, and how I'm going to describe it. So this is going to be under the we call descriptive epidemiology, or the part of the distribution. Now the second part is the determinants. Determinants are all physical, but it can be the causes, the cause of the occurrence of the disease, because the disease is not randomly distributed. It means that those people who have certain kind of characteristics or behavioral factors, it can be biological, it can be social, it can be cultural, it can be environmental, behavioral, that influence your health. Whether you sleep in the mosquito net or not, that will influence whether you're going to have malaria or not. Whether you use condom or not, that will also influence whether somebody is going to have sexually transmitted disease or not. Whether somebody is exercising or not, that also going to influence about something about their coronary heart disease in the future. About their dietary habits would also influence whether they're going to have high cholesterol, and then strokes, coronary heart disease. All these are determinants. Okay, we have to know all this in order to understand the epidemiology of the disease. So that's why when we say we're going to study about the risk factor, so the risk factor can be, as I already mentioned, environmental, social, biological. Okay, exposure, it can be genetic, inborn, inherited. Okay, all these can be a risk factor. Some of the factor can be harmful, some of the factor we call factor, preventive factor, can be benefit. For example, children who are on breastfeeding would have a less diarrheal infections compared to those who are bottle fed from birth. Okay, so these are some of the things. So I would like to give you example. This go back to 1854. Okay, in London. Then you will see that at that time we do not have the word epidemiology. Yet this man started the word epidemiology. At that time, he's the father of epidemiology. So he studied about the cholera, okay, in London. So he's an anesthesiologist, but he has an interest in understanding about how the cholera spread in London. So he's using doing hand manually. He's putting each house where are the cases, and he put the dots. Okay, for one case, here is the death. Okay, the house that have a people died from cholera. At that time, they don't even know that this is the microbial agent. They just know that they just name it cholera, and then they think that it's is bacteria or virus. They don't know anything. Okay, they know that it just caused a severe diarrhea and then they die. So what happened is that then this is the distribution. So here when we do this much, then we see that that is this distribution. You say that it's concentrated in the certain area, okay, of what Jon Snow is doing, and he is looking at the person who died. He looked at the children also died, adult also died, elderly also died. There is no discrepancy between male and female so much, and age also not. So most of the people died across all the age group. And then now when he would like to study about the determinants, then he has the hypothesis that it may related to which pump that they drink the water, because he suspect that the water may be the source of this cholera. So he would like to associate this association, link, okay, when would you like to have a relationship or link with certain determinants. Here is the cholera death, try to link with the pump. So the purple color there is the water pump. You have the pump here. He would like to look at the relationship, and then he look at the relationship of the death for each pump. Okay, and then I am using the modern GIS software to use the original data of Jon Snow in 1854 there, still there. So, and then you plot a graph there. So you see here that certain pumps are contaminated, certain pumps you don't hardly have any death. So therefore pump number 5, number 9, number 4, some of the pumps here are related. So here is the determinants. So this particular part we call analytic epidemiology. So you understand what, who, when, where in the first part, okay, and then in this particular part you know why, how, why people living close to pump number 5 die more than people live near the pump number 11, 8, 7, 10, 12, 1. Okay, so it has a very clear conclusion that is related to drinking from the water pump number 5 and some number 9 and number 6. So therefore what does he do? Okay, he said that then it has to do with the pump. How are we going to do the applied epidemiology? How are you going to do the intervention? You remove, then he with the mayor of London remove the handle of the pump and ask the people not to drink from pump number 5, number 9, and some pump that have a high mortality. And okay, and this pump is still in London, okay, in the Broad Street. You see, so if you go to Broad Street in London, you will see this pump. So therefore, that is about the principle, the basic understanding of the epidemiology. So when you study the outbreak investigation, then you have to know that descriptive epidemiology will have a study design for descriptive epidemiology. Analytic epidemiology, when you are going to seek the answer of why and how or determinants, then you have a cohort study, case control study, case cohort study, nested case control study. All these studies are needed in order to answer why and how or determinants. Okay, you use cross-sectional or longitudinal study to study the incidence and prevalence and also describe about the occurrence of the disease in the populations. Okay, so that is the basic ideas about epidemiologic approach. So basic, many of you might have learned it, then just a repetition to what you have learned, but it will be some beneficial or just a repeat for those who do not have the background in epidemiology. So therefore epidemic and endemic, okay, you can see here endemic is the usual level of occurrence, is usual to that particular geographical area. Okay, it's not it's normal. So let's say if you have this certain level of diarrhea, let's say in Bangladesh, in certain geographical area, they have a certain level of diarrhea occurring among themselves, so it's normal, so we call endemic. But suddenly when it becomes unusual, it means that it shoot up from the normal level rapidly with a short time, and it affects a large number of people in a very short time, and it becomes the abnormal occurrence, it means that it's very high, then that is become the epidemic. Okay, so and then we have a pandemic when it is more than one continent, so it spread worldwide, many countries, more than one continent, then it's become the pandemic. Endemic, it can be, for certain countries it can be we call hypo-endemic, very low level. It can be hyper-endemic level, it can be hollow endemic level. It depends on the level of the occurrence within that particular country. So therefore endemicity can be very low or can be very high. It depends on the usual level of that particular country. Okay, and then we have certain terms. Incubation period is the time of exposure to the onset of sign and symptoms. Okay, so incubation period is quite important because let's say if you are exposed, let's say quarantine. You see why they quarantine you? Because they know that the incubation period of alpha variant, Wuhan variant, it can range from 3 to 14 days or 2 to 14 days. So that's why in the earlier part, when we do not understand about the virus very well, we are trying to separate you from other people, because we feel that if you're going to have the sign and symptom, it would come by 14 days, the longest, but the shortest time it will be earlier than that. So that's why we quarantine you if you have a exposure to the infective COVID patients. And also the latent period is can be shorter or longer than the incubation period. This is the period between exposure and the onset, not the symptom, but the onset of infectivity or infectiousness. So it means that when we say latent period of, let's say, Omicron can be, latent period is shorter because it can transmit before you have a sign and symptom. It means that it can transmit 2 days ahead of sign and symptom it is going to come. So that we call the latent period. So as I already told you, the level of occurrence can be sporadic, can be hyperendemic. Okay, and also in infectious disease, once you are infected, okay, and also to the disease, then later on you can become a reservoir. So reservoir can be human reservoir. If it is also infect animal can also be animal reservoir. Parasitic infections and also some of the bacteria can be in the non-living reservoir. Okay, usually it will be parasitic infections, mostly in the soil, okay, in the plant, eating raw some of the morning glory or some of the water hyacinth. You can liver fluke infections. We call Fasciolopsis buscae. Okay, but if you eat a raw fish, then it will be that is a living thing. So it can be in the fish, it can be in the snails, okay, and it can be in the animals or human. The human also can become a reservoir and shed infections. So therefore, it can be that you can shed the infection reservoir when you become a cases, primary case, index, okay, a secondary case, or while you have a subclinical infections or clinical infections, or you can have latent infections. Okay, so all these during you can be a reservoir and spread the disease, and then it can be a carriers. Okay, carrier means after you recover from the disease, like typhoid, you can carry on the typhoid bacteria for a long time. It can be months and years. Like classical case is the Mary typhoid. It can be during carrier, can be incubatory during incubation period, convalescent, and during it can be chronic carrier. Okay, all these are something that. So I would like to show you a little bit to understand about the epidemiologic triad. That is when we approach the determinants of the disease, we should look into what are the factors that related to the agent, what are the factors that are related to the host, what are the factors that may be related to the environment. For example, if you're going to describe the agent, you can looking at the aspect of infectivity, as I told you, pathogenicity, virulence, okay, whether the agent is biological agent, like I already mentioned about whether it is microbial pathogen, physical agent, it can be race, it can be heat, it can be chemical, it can be mechanical, it can be a social aspect, okay, it can be and host biological characteristics, social demographic characteristic, and then environment can be social environment, physical environment, and then the other environment that it may be related. So therefore, I'd like to show it to you that if you think like this, if it is going to be any infectious agent, so we have to say immunogenicity, antigenic stability, survival, variant, okay, of the agent, infectivity, pathogenicity, and host, vaccination, whether they have immunity, vaccine, okay, environment, what kind of environmental condition that can propagate the agent well, whether it is the humidity, rain, temperature, okay, the air, whether circulation of the air can spread well the airborne infections or not. All these are important. Okay, these are something that I would like you to understand it. And then we have a convergence model. When you look at the determinants, okay, I would like you to look at the microbe will be interacting with human, and then there are many factors that outside the human that may influence the transmission. Whether the transmission of any particular disease, not only the agent, but also for example, tuberculosis. You will see that in the culture that you have people who spit a lot. There are chance that agent may be spread to the external environment will be more than the culture that do not spit too much. Okay, so this is one of the aspect that we have to understand about biological, environmental, social, political, because all this would influence the spread of the disease and the control of the disease, prevention of the disease, and also whether you're going to have virulence or not. Although the agent is virulent, but if you have a good healthcare system, the case fatality rate would also can be low. It's not only depend on the agent, but it also depend on the environment, the system that you live in. So there are social determinants of health also important. Okay, the place where you are born, you live, okay, you work, and then you die there. It's all related to. So therefore, this is we call the convergence model. But when all the factors come to converge together, so it's not simple causal relationships, but it's a web of causations that it may lead into that particular outcome or the disease. So as I already mentioned, there are so many aspects of why there is emergence of the infectious disease, because there are many factors: globalization, trade, transport, host susceptibility, human-animal interface. Just to summarize to you, increased urbanization, change in the demographic structure, you have a new species, microbial spills, or jumping from wildlife to domestic animal to human, climate change, environmental degradation, land use and land cover which change. All these may promote the emergence of the infectious agent. So what are the future threat? Future threat is still there. We have currently the COVID-19 pandemic. The next pandemic will be coming soon. Okay, we don't know when, but it's going to come. Okay, so therefore it is a threat to human health and global health security. And the COVID, we don't know the new variant is going to emerge that is going to have high virulence or high pathogenicity or not. We're going to, if we don't have then we have to have a vaccine that is going to combat with that. And then that's why newly recognized infectious disease, and it may be resistant to the drug that we have now. Okay, let's say we're going to have a new maybe antiviral drug, okay, for COVID. If it is resistant, then we have to develop the new one. So we still have big challenges of the infectious disease. Novel pathogens will come, it will appear, okay, and more animal will be infected, more human, and then that is a potential emergence of new pathogens that it will lead into epidemics. So therefore we need to build, okay, our system ready. We have to be adaptive, we have to be prepared. That's why early diagnosis, vigilance, surveillance, collaborations, using the One Health approach, okay, human health, animal health, environmental, ecological system health into consideration. So holistic interdisciplinary approach is needed now that we have to solve the issues, we have to prepare, and also we have to have a health system that are ready to cope with, because we already have the experience, and this experience will teach us in order to cope with the future pandemic and infectious disease that is going to come in the future. So it's going to continue these challenges, and we have to look forward in the future. Okay, so this is the tape one. I cannot entertain with any questions, but I hope that you should benefit some of the things that I have mentioned today, and I hope that during your field work you could apply some of these principles in order to study in your field work, because in the field work all these three components of human health, animal health, and environmental or ecological health would be shown to you, so that you will understand more about the One Health approach on infectious disease. Okay, I would like to end my talk here. Thank you very much for your attention. Thank you.